like to have a lot of fun here on 8 West, exploring new places and sharing fab finds, but it's really important for us to bring you information that could help you live well, too.
And that's why we're focusing on breast cancer awareness this month. We know it impacts so many people, and there are steps you can take to detect it early, and we know that all women need to be connected to this information.
So joining us today is Dr. Marianne Melnick, a surgical oncologist with Spectrum Health Medical Group Breast Care Program. For all women here, what do we really need to know? Because October is a really great time for awareness, but this is something we have to be concerned about all the time.
It is, but breast cancer is common, but it's definitely not a death sentence. Far, far from it. We cure 85% of all women with breast cancer. For many, it's an inconvenient process they have to go through, an inconvenient time, but they get through it and it becomes a pass for them.
You know, and it really is incredible, because when you give the diagnosis, when you talk to women who hear the C word, cancer, especially breast cancer, right away you know your life flashes before your eyes. But really, it's that early detection that allows those survival rates to be so impressive.
That's very true. And forefront in that is, of course, mammography, which there's been a lot in the media about that lately. We still recommend women do self-breast exams. We have new imaging modalities that are superior to the older things we had. Certainly digital mammography compared to the old zero mammograms, breast MRI, breast tomosynthesis. And then, of course, there's the new medications, both if a person has breast cancer or things that can prevent breast cancer. So there's a lot out there that's really
So let's talk
impressive.
about the risks and who is most at risk, in developing breast cancer or...
Well, everybody thinks it's family history, but actually the two biggest risk factors are, number one, being female, and number two, age. So the older an individual gets, the more likely it is that they will develop breast cancer. That 1 in 8 number they refer to is that's a woman that reaches age 95. It's not your age currently. It's when you get to 95, you have a 1 in 8 lifetime chance of getting breast cancer.
Well, and you talk about aging. I know that when I turned 40, the information I got from my doctor was every year now a mammogram. Is that the recommendation?
Yes, it is. There have been a lot of task forces that have looked at that paper that came out about a year ago now, and everybody still firmly believes that women age 40 should start yearly screening mammograms.
Well, I had the recent opportunity, as I was showing at the beginning of the show, to tour the Betty Ford new exhibit that opens tomorrow. I've been to the museum quite often, and Betty Ford is a woman who's really made such huge strides for women around the world. She's from West Michigan, and we have the Betty Ford Breast Care Services right here in Grand Rapids. And what kind of things happen there?
Oh, we're very fortunate to have that name and that legacy here. Oh, we try very hard to move immediately on an abnormal mammogram, get additional imaging, ultrasounds done immediately, perhaps biopsies done in the same day. We have the multidisciplinary breast cancer clinic for women newly diagnosed that can meet with a number of specialists to come out with a plan that same day. There, as I said, breast MRI has made a huge impact in our recommendations for treatment. And then there's genetics. Genetics, although only 5 to 10% of women with breast cancer have a genetic predisposition that we can test for, it still is huge in terms of our recommendations and impact to them.
Well, and it is really incredible, too, because you talk about having all of that, all of those specialists, all of those people together who can collaborate on each individual patient. I mean, you're getting the best care that you would find anywhere in the world right here in West Michigan. And you actually have a seminar coming up that you invite women to attend to learn more. Will you tell us more about that?
Yes, it's this Thursday evening at 7:30. It's for individuals out in the community. I guess it's 7, sorry. We're going to have an individual that had one of the genes for breast cancer and tell her story about how it impacted her and the rest of her family, and she, the treatment she had to go through, and hopefully treatment she did not have to go through because of the choice she made with her surgery. Just information about the most up-to-date
technologies and everything. It's so great to even just step into the Lemon Holton Cancer Pavilion. I mean, it's a state-of-the-art facility, and even just being there, and people can get their questions answered. So thank you so much for doing that and coming on here and sharing this important information, because it affects a lot of people.
That's right.
Yes, it does.
And if you're interested in attending that seminar, reservations are required, but it is free to attend. You'll find all the information on our website at woodtv.com.
We'll be right back.
Are you West?